Imagine this moment for a second. The clock reads 6:47 in the morning. The sun has barely started rising. Your alarm has not gone off yet, and yet your eyes suddenly open. Nothing dramatic woke you. There was no loud noise outside, no painful cramp, and no disturbing dream pulling you out of sleep. Instead, it is something much simpler, but also much harder to ignore. Your mouth feels incredibly dry. Your tongue seems stuck to the roof of your mouth, as though every trace of moisture disappeared hours ago. Your lips feel cracked and uncomfortable, and your throat feels rough, almost as if you spent the entire night breathing hot desert air. You immediately start searching for a glass of water beside your bed because swallowing feels difficult and unpleasant. If this sounds familiar, you are far from alone. Millions of adults over 60 experience this exact sensation every morning. Most dismiss it as a harmless inconvenience or another. The second major cause of morning dry mouth is something far more serious than many people realize. It is a condition that affects millions of adults, yet a large percentage of those living with it have never been diagnosed. That condition is obstructive sleep apnea. To understand the connection, imagine what happens while you sleep. Normally, air moves freely through your nose and throat throughout the night. But with sleep apnea, the tissues at the back of the throat can partially or completely block the airway. When this happens, breathing becomes restricted, and the brain briefly signals the body to reopen the airway. These interruptions may occur dozens of times every hour without the person remembering them the next morning. The third cause of persistent morning dry mouth involves something that affects millions of people worldwide: elevated blood sugar levels. What makes this cause especially important is that many individuals experience warning signs for months or even years before receiving a diagnosis. When blood sugar remains higher than normal for extended periods, the body must work harder to remove the excess glucose from the bloodstream. The kidneys take on much of this responsibility. To flush out extra sugar, they pull additional water from the body's tissues and increase urine production. Over time, this process can contribute to ongoing dehydration and reduced saliva production. As a result, one of the earliest and most noticeable symptoms may be a dry mouth that seems to appear every morning. Many people treat the symptom itself without realizing it could be connected to their blood sugar levels. At Vital Aging, we encourage adults over 60 to pay close attention to accompanying signs: frequent nighttime urination, unusual fatigue, increased thirst, slower healing of cuts or scrapes, and occasional blurry vision can all occur alongside elevated blood sugar. The important thing to remember is that your mouth may notice a problem before the rest of your body does. What seems like a simple lack of moisture could actually be an early clue that your glucose levels deserve closer attention. If morning dry mouth is becoming a regular part of your life, especially when combined with any of these additional symptoms, discussing blood sugar testing with your healthcare provider may provide valuable answers and help prevent future complications. The fourth cause of morning dry mouth may sound simple at first, but it is far more common and more complicated than most people realize. We're talking about chronic dehydration. Many older adults immediately respond by saying, "But I drink water throughout the day." And that may be true. The challenge is that hydration changes as we age. The body's ability to recognize and respond to dehydration is not as reliable at 65 or 75 as it was at 35 or 45. One of the key reasons is that the brain's thirst mechanism becomes less sensitive over time. In practical terms, this means your body can already be running low on fluids before you ever feel thirsty. At the same time, aging kidneys become less efficient at conserving water, making it easier to lose fluids